And now, a test of our own. 30 million Americans say they've consulted with their doctor on email. Another 70 million say they wish they could. But a lot of doctors still don't offer email consultations, so some websites are filling the void. But how effective are they? Consumer correspondent Elizabeth Leamy and GMA medical contributor Dr. Marie Savard decided to put them to the test.
Things have changed since the days of Marcus Welby, MD. The TV doctor was famous for taking a personal interest in his patients.
If you follow our advice, you'll be back in no time.
But now you can ask a doctor for advice without even meeting face to face.
Our caring doctors are waiting to answer questions concerning you or your loved ones.
First, we took advantage of a free media trial at a subscription site called eDoc America. We asked for advice about one of Dr. Savard's actual patients, a 35-year-old woman with unexplained itching and fatigue. Dr. Savard knew what was wrong with the patient, and we wanted to see what the website would recommend. The eDoc America doctor told us our patient should get blood tests to check for an underactive thyroid. That's a reasonable suggestion, but not our patient's problem. So next we tried a website called Live Person. The site posts doctors' pictures and credentials, and you pay by the minute or question for advice.
It totally reduces medicine to like piecemeal work.
For $25, the Live Person doctor also pointed to hypothyroidism. He suggested our patient get tested for diabetes, too. Again, reasonable conclusions, but wrong. Time for a site called Just Answer, where you can get advice on everything from what's ailing your car to what's ailing you for $9 to $30.
I'm totally skeptical.
In just 3.5 minutes, a doctor responded. "You are having an attack of acute urticaria," he wrote. That's a skin allergy. He didn't suggest our patient should get checked for it. He said she had it. Only when we pressed him did he mention other possibilities like liver and kidney disease. It was a tough case for online doctors to assess because they didn't have the benefit of a physical exam. If they did, they would have found enlarged lymph nodes, a hallmark of Hodgkin's disease, a type of cancer. Dr. Savard's real-life patient kept asking her primary doctor to prescribe skin creams over the phone, and then finally visited Dr. Savard in person for a second opinion.
By her failing to go to her doctor's office, getting that hands-on exam, she really delayed that diagnosis, many months.
Live Person and Just Answer both say they are not responsible for the advice their experts give. All three websites say they are not intended to be substitutes for people's personal doctors. And they all recommended testing, which would have resulted in a doctor's visit.
Angela, hi, it's Dr. Dappen.
Much more common and less controversial are regular doctors who make telemedicine a part of their practice. Dr. Alan Dappen knows all his patients personally and requires them to see him for a face-to-face exam before treating them remotely.
We're not trying to not see you. I'll see you 7 days a week. If I have a doubt, you're coming to see me.
How was your day? Nice.
Mary Paget and her family are patients.
It's not just someone over the internet or that I talk to on the phone. I actually know him and he knows everything about us.
I have many cases that have happened over the last 5 years where I feel that my answering the phone resulted in a significant outcome difference for that person.
Today, Dr. Dappen conducts half his visits by phone or email. It's freed him up so he can now offer good old-fashioned house calls, kind of like the beloved Dr. Welby. For Good Morning America, Elizabeth Leamy, ABC News.
So what to do? Well, our experts say if you want to try telemedicine, don't use it for any condition that seems pressing, one that you can't wait 24 hours for an answer. And also, some insurance companies will pay for phone and email visits, so you can try to get reimbursed. For more information, log on to our website, abcnews.com.